Hello everyone. Our topic is the rattlesnake bite. The situation. A dog has entered our clinic and is developing symptoms of a rattlesnake bite. He was bit on the lower hind leg. The wound is swollen and is beginning to ooze blood amongst other fluids. Due to the swelling in the leg, the dog is no longer able to bear weight on the leg properly. Etiology. A rattlesnake bite can manifest itself in a variety of different ways, but let's first understand why these symptoms arise and what causes it. Most venomous snake bites consist of the same enzymes and toxins. The two biggest enzymes that cause these symptoms are hyaluronidase and phospholipase A. Hyaluronidase allows the venom to spread rapidly in the body by breaking down tissues. Phospholipase A stimulates for a myofibril rupture, also known as a breakdown of muscle tissue around the site of the bite. As it further spreads throughout the body, the venom enzymes further break down body systems that it reaches, which can cause a variety of symptoms, including neurological, excessive slobbering, and severe GI symptoms such as diarrhea and vomiting. Clinical signs local to the site. For the localized symptoms, most bite sites can vary by severity. If the client waits longer to bring in their pet, the symptoms will be more severe rather than receiving immediate attention. These symptoms will often manifest as swelling and pain around the site of the bite. Bruising severity can also depend on case-to-case scenarios and can become more intense the longer you wait. For more severe cases, discoloration can occur and is often seen as an intense red, but can also turn blue or purple. As for the rest of the body, there is a variety of factors that can change the symptoms. One of the biggest factors is how long the client waits to bring in their pet and how much the rattlesnake was able to inject its venom. The most common severe symptoms are hemolysis and localized necrosis, or death of the tissue around the site of the wound, as well as cardiac symptoms such as shock. If the symptoms are not managed properly, it can cause difficulty breathing as well as vomiting and diarrhea. For at-home treatment prior to a pet being brought in, keeping the pet calm is crucial. Keeping an animal calm reduces the flow of the venom throughout the body. Keeping the site of the bite below the heart also reduces the risk of the venom reaching the heart. Once the pet has arrived to the clinic, it is important to administer the proper antivenom dose to reduce any further symptoms that may arise. Once the dose has been administered, monitor vitals, the site of the wound for increased swelling or necrosis, and keep the pet on supportive care for at least 24 hours. This can include IV fluids. Though it is divided amongst the veterinary medicine community, it is often recommended that your pet receives a rattlesnake vaccine in areas with a high prominency of rattlesnakes. The vaccine will allow for symptoms to not be as intense if the pet is bitten. A DVM will best determine how frequently your pet should receive a rattlesnake vaccine. If the DVM decides to not administer a vaccine, there are other ways to avoid a bite. If you are visiting a populated rattlesnake area, stay on marked paths and be aware of your surroundings. Keeping your pet on a short leash no longer than 6 feet can prevent unwanted wandering into these unmarked areas. Another useful way to avoid rattlesnake bites is training for rattlesnake avoidance. It will take a good amount of time, but finding a trainer or even a behavior specialist can help for training for rattlesnake avoidance and is immensely useful. Once properly trained, if a pet spots a rattlesnake or even a snake of any kind, they will instinctively avoid the area the snake is in, thus avoiding a bite. Post-treatment care will always vary based on the severity of the bite. Oftentimes, a patient will be prescribed about 3 types of medications: an NSAID or a nonsteroidal anti-inflammatory drug, an antibiotic, as well as an opioid. The NSAID and opioid will be used for pain management as well as swelling of the bite. The antibiotics will be used for prevention of secondary infections. Taking these medications as prescribed is very important. Keeping a clean wound is also extremely important. The best way to clean the wound is using a warm, sterile saline solution and gently washing the wound without agitating or scrubbing it. Once the wound has been cleaned and dried properly, placing a clean bandage on the wound will add an extra protection. Replacement of the bandage every time the wound is cleaned is extremely important in its recovery.